lost my sister to a substance use disorder.
Growing up, I definitely had a lot of anxiety.
I noticed that my daughter was needing some help. She was starting to show some signs of depression.
I lost two good friends to suicide.
We're kind of in a dire situation.
When I left the office today, another care provider said, "I'm exhausted. I'm just exhausted." I had 3 yesterday, 3 suicidal teenagers. We used to get 1 a week, maybe 1 a month, but suicidal, like today. I'm thinking about doing it. That increase is traumatic.
Now here recently with the pandemic, we've gone through a mental health crisis, an epidemic across the country, to a tsunami. It's horrible. Places that I used to be able to get people, I could push and pull and I can get someone in, I can't do that anymore.
It's really heartbreaking. We don't have enough psychiatric care. We don't have enough affordable care. We have 0 pediatric, psychiatric inpatient beds, which just can kind of take me over the edge out of concern because I've seen what's happened.
And every single day at PD Place, we fight the issue, how are we going to provide services to these children?
A lot of our students are dealing more with more stress, more anxiety because they put a lot of pressure on themselves. And dealing with the pandemic, a lot of them suffered with relearning their behaviors because they were isolated for so long. Some of them have to learn how to make friends, how to set boundaries for when they communicate with other students.
A child can't separate the academic part of themselves from the social emotional part of themselves. And so if those struggles are there, it means that they don't have the ability to focus or the ability to receive information. So without that mental health being intact, it is really often futile to try to get that academic success there.
I cannot even begin to tell you how heartbreaking, frightening, and challenging it is for families to hear their child say, I don't want to live anymore.
Our children are the future, and mental health, it needs to be on the #1 top lists of things that we need to work on our children. Because if their mental health is not stable, their future is unstable.
It's time. It's time. Too many children are dying. Too many people are dying. Money needs to be put where people's mouths are. That mental health is important, we'll put the money there. Right now, it's not.
This effort is not siloed to education or the judicial system. We need everyone. We need everyone to say this is important. We need everyone to put skin in the game. And it is really exciting to think about how much further we could go when we had donors from all ends of the county who are willing to jump in and support us.
And without United Way's funding, we're not able to be here to serve these kids.
Having had the opportunity to be a volunteer in that committee and to review the grants and to observe the philosophy of the United Way and how they do that, I will say your money will be looked after. In terms of staying local, as much as possible guaranteeing good stewardship, making sure that the funds are spent the way and in the spirit that they're donated.
All of us together, United Way of Denton County partner agencies, the community, donors, we can fix a system like our mental health response system that isn't working for our community, but our community absolutely needs us to make work.
I think we keep that collaboration going. We'll both keep educating each other, and we'll provide better care to children in this community. So I am hopeful.
Let's live united.
Let's live united.
Let's live united.
To build a healthier Denton County.
For all of us.
For everyone.